what out of control caseloads and deaths look like.
Looking at another provincial lockdown, Doug Ford delivered the Boxing Day deadline, and business owner and teacher Priya Mohan was watching.
I think they're calling it the COVID pivot. We're doing another COVID pivot, so that happens both at the store and at school.
For most of the province, the lockdown will last at least until January 23rd. Restrictions include no indoor gatherings with anyone outside your household. Non-essential retail is limited to curbside and delivery, and back to school is impacted too. In-person school won't start until at least January 11th.
This difficult action is without a doubt necessary to save lives and prevent our hospitals from being overwhelmed.
Without new measures, modeling shows new cases and hospitalizations could skyrocket.
Even schedule their surgery.
Which is why this doctor says don't wait to act.
All I can ask my community and everyone in Ontario is that even if the lockdown doesn't start till Boxing Day, it is our responsibility to follow the instructions and stay at home as if the lockdown started today.
But in areas where cases are low, some pushback. In Ottawa, there are 19 COVID patients in hospital, 0 in the ICU. This doctor says the new restrictions don't add up.
I see more patients with mental health issues, with substance abuse, with overdoses currently than I do of COVID-19.
Still, this infectious disease physician defends a widespread lockdown.
I think we have to assume that there is going to be transmission from high incidence to low incidence settings, and that's going to set off local problems.
Even though this will hit businesses across the province hard.
This is awful and this is bad, but losing people is awful and bad too.
For as long as it takes, Mohan will keep business going with curbside pickups, and her classes will go virtual next month.
Well, Magda, we know this lockdown is province-wide for now, but some parts of the province are going to drop restrictions sooner than others.
That's right. So Northern Ontario will actually be in this lockdown for half that time. And that's because that's really an area of the province that hasn't been a hot zone for COVID-19 cases recently. In fact, the CEO of Health Sciences North said that hospital doesn't have any COVID-19 cases, but he does warn that if people don't follow the rules over the holidays, well, of course, things could change and head in the wrong direction. And that's where we find ourselves in many parts of southern Ontario, where the lockdown will last for at least 4 weeks now.
Thanks for this, Magda.